Good morning in California and the West Coast. Good afternoon on the East Coast. The nuclear industry is staging a comeback across America, and the data suggests that the children living in its shadow may be paying the price. I'm Lance Gould, CEO of Brooklyn Story Lab, and for many years a senior media partner of the nonprofit Radiation and Public Health Project, or RPHP. We're here today for an event called Diablo Canyon Harming Children's Health. We're going to learn more about the findings of a troubling new report, one that looks closely at newborn health in San Luis Obispo County, California, home of the Diablo Canyon nuclear reactors, the last nuclear reactors in California. We'll also explore what these findings tell us about the true cost of nuclear power at a moment when the industry is pushing hard for expansion. What we can take away from today is this: communities living near nuclear power plants deserve honest, independent science, and that science has to inform public policy, especially now, as states like California and New York move to dramatically expand nuclear power by opening new facilities, keeping decaying facilities going, and even reopening facilities that had previously been shuttered. We'll hear today from two essential voices in this fight. First, the scientist behind the numbers, Joseph Mangano, an epidemiologist and the executive director of the Radiation and Public Health Project, an organization he has been part of since 1989. In that time, Joseph has authored 43 peer-reviewed scientific journal articles and 3 books on the health hazards of living near nuclear reactors. His new report on San Luis Obispo County is stunning, and he's here to walk us through it. 2 quick housekeeping notes. We welcome your questions. Please write them in the chat. We will select as many as we can get to after our distinguished speakers have made their presentations. Please also kindly remain on mute during the presentations. Joseph, the floor is yours.
Thank you, Lance. Today we are presenting a new report and the first report ever on health near the Diablo Canyon nuclear plant in San Luis Obispo County, California. There have been no studies of Diablo Canyon, basically because there have been, until recently, no studies of nuclear power plants and local health by government. There's only been one such study, and that was done in the 1980s. Just recently, however, Harvard University's School of Public Health published a journal article, which did include Diablo Canyon, showing that 115,000 excess cancer deaths occurred near U.S. nuclear plants in a recent 19-year period. That's not, the fact that there have been no studies is not to say that there have been no concerns. One concern is the routine releases of over 100 radioactive chemicals from Diablo Canyon and all nuclear reactors. We see, and it's in the report, that in certain years there have been outliers, large releases compared to most years. The other concern was raised with a unique study that we did where we looked at the levels of strontium-90 in baby teeth. Strontium-90 is one of these 100 plus chemicals only found in nuclear bomb explosions and nuclear reactors. We found over 100 teeth in California. The highest levels, 30% higher, were those living near Diablo Canyon. And we found a 50% increase in strontium-90 between babies born in the late 80s versus the late 1990s. So there are concerns. This study is going to, it's not a comprehensive study. It's only going to focus on newborns and young children, because the fetus and infant, we know, are at greatest risk of exposure to radiation. We selected CDC data for most of our evidence. And what you'll see in just a few moments is we're comparing the trends in rates of babies born abnormally in San Luis Obispo County versus the state of California. Let's go into the results. And if I could have the first slide, please. The CDC provides mortality information all the way back to 1968 by county. And what you see here are 3 bar graphs, each representing the county versus the state infant death rate, deaths under 1 year old, for certain time periods. The first one, number one, the one on the left, is the period before the plant opened. And there, the infant death rate was 16% in SLO County compared to California. Number two, which I'll call the early years of Diablo Canyon, the county rate was 14% below, but the big change came with number three. That's the most recent period, 2010 to 2024. The current rate, county rate is now 1% above California. And for whites, it's 11% higher, and for Hispanics, 23% higher. What we see here is for infant deaths, what used to be a low rate county has turned into a high rate county. The next measure of newborn health we used, I don't have a graph for, but it involves the change in the rate of babies born prematurely. Unfortunately, the CDC data only starts in 1995, which is still early in the life of Diablo Canyon, which opened in the mid-1980s. In the late 90s, the SLO County had a premature rate 21% below the state. But in the most recent period, that good number has disappeared, and the county is now 3% higher. We've gone in the early 2020s. We've gone from 21% below to 3% above. And that includes an 8% excess for whites and a 31% excess for Hispanics. This comes out to about 400 to 500 excess premature deaths. In other words, if that 21% below number had continued over the last 25 years, we would have had 400 to 500 fewer premature deaths in the county. Okay, the third number, and that I'll ask for the second slide, the last slide. The CDC identifies 12 different birth defects, including common ones such as spina bifida and cleft palate. These, they only have data for the last 9 years, 2016 to 24. These bar graphs show the counties in California with the highest rates and the lowest rates. And I don't know if you all can read them, but on the left are the three highest ones. The third highest one is SLO County, which had a rate 114% above the state of California, more than double, and more than 6 to 7 times higher than some of the lowest counties in California. We looked at other measures of newborn health that the CDC identifies as being of risk to the newborn. The most common ones are all show that the county is high for the past 9 years. Newborns requiring ventilation, 189% higher. Newborns with low APGAR scores, which is a measure of the baby's health after 5 minutes, 69% higher. Newborns transferred to other institutions, 66% higher. And newborns admitted to the intensive care unit, 1.7% below the state, basically the same. The question, of course, here is, why is this occurring? The report takes a look at several of the possibilities. First of all, the general demographic issues. In every one of these, the county is less than the state. Its percentage of minorities is low. The percent not graduating from high school or college is low. The percent foreign born and not speaking English at home is low. Percent below poverty is low. Then we went and looked at CDC's maternal risk factors that are most common in mothers that might lead to a abnormal birth. All low. These include where a mother has had a previous cesarean section, a mother is poor, is either on Medicaid or received WIC benefits, the mother is obese or overweight, low. The mother is under age 20, low. Mother over 35, low. And mother had either no prenatal care or late prenatal care, low. So, what the report has done is shown that, again, what used to be a low weight or a low risk county is now a high risk one for newborns. And we don't have any obvious reasons why. I want to say something about prematurity and low weight births. We know that intensive care units and others do a lot of great things, but premature babies are at higher risk for many different diseases, not just as infants or as children, but even well into adult study shows. And that's well documented on the internet. As far as what to do with the study, where we go next, well, this is not rock solid proof that Diablo Canyon caused all this. It is certainly a red flag showing that there is a problem here that only occurred after the plant opened. So we need more studies, not just of newborns, but of children and adults. And maybe, perhaps more importantly, before any decision is made to whether or not to grant a 20-year license extension of Diablo Canyon by the Nuclear Regulatory Commission, this issue of health should be shared with the public, shared with leaders, and thoroughly discussed. Okay, I'll be glad to take questions later, but first, it is my pleasure to introduce our next speaker, Christy Brinkley, who many of you know as a model and an actress and a businesswoman, but we know her as something much more. She has had a lifelong interest in public policy, in particular in environmental issues, which one of which is the health effects of radiation. She was a board member of the group Standing for Truth About Radiation, and she has joined our group over 20 years ago and is now on our board and is our vice president. She has spoken at a number of our events. She's testified to Congress, written op-eds and written letters to the New York Times on this issue. And I'm especially glad that she has joined us today because from the beginning, Christy has, as a mother, she is concerned about radiation effects on all humans, but especially on the young, especially on the babies, especially on the children. And I'll also add that as someone who grew up in California, she was involved and concerned about Diablo Canyon from a long time ago. So with that, I give you Christy Brinkley.
I'm here today speaking to you as a mom. I don't pretend to be a scientist or know the finer points between fission and fusion and all of that. But I have learned a lot since the day I discovered that I was living in the crosshairs of 3 very old, very troubled nuclear power plants. You can imagine I left New York City when I had my first child, and I moved to the Hamptons so that my baby could grow up in the clean ocean air. And then I find out that I've got Millstone, Indian Point, and Tom's River, all in the crosshairs here. And I found out about it at a meeting that was pulled together by Dr. Helen Caldicott, who is a leading pediatrician, also very concerned about the effects of this low-level radiation on children, specifically children, because their cells are dividing at a faster rate than grown-ups. But at a certain point, we're all affected by the toxicity of these filthy giants in our midst. I was also really angered to learn, I grew up in a society that has warning labels on pillows and warnings about seatbelts and bike helmets, and really making us feel like our government has really taken everything into consideration to keep us safe. And yet, when they build a nuclear power plant in a neighborhood, there's no warning labels. There are no people testing to make sure that this nuclear power plant is safe and secure, that it's not leaking or emitting dangerous anything. It's up to the community that surrounds the nuclear power plants to do the scientific studies. And that's why I was so thrilled when I met Joe Mangano, who is constantly crunching numbers and constantly coming up with other ways to measure uh, the effects of these power plants. And I think the study that we call the Tooth Fairy study is really one of the easiest to understand. It's very compelling because we all, as parents, we've all collected our children's teeth, and then we put our quarter or 50 cent or the dollar, whatever, with inflation, under the pillow. Um, and way back in the 50s, President Kennedy started collecting those baby teeth so that he could test. The open air testing of nuclear weapons was going on, and that was having an effect on children. And he gathered the children's baby teeth so that they could go to a lab in St. Louis and be studied. And they found strontium 90 in the teeth. Now, for those non-experts like me, you need to know that strontium 90 is never found in nature. This is not something that nature produces. It is man-made. So the only way that it can get into your children's baby teeth is through a man-made ingredient, man-made somehow. And this happens when fission happens. And therefore, it's connected to the power plant. We know that's where it's coming from. That's what makes this so compelling. When a child's body, or even the mother's or the father's body, comes in contact, the body thinks it's calcium and deposits the strontium 90 in your bones and in your teeth. And that's why when the children's teeth fall out and we become the tooth fairies and collect them and measure them, this study has had such an impact. So all this to say, that they're not taking care of the communities where these power plants are located. And our studies do show that they are having an effect on the communities. And as a mom, I want other moms to know that. I remember the shock I felt the day I found out that I was, in the crosshairs of these power plants. And ever since then, I've been trying to stay alert and hold them, I've been trying to close them, actually, and we have succeeded in closing a very old and leaky uh, 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 reactor at the Wading River. And it was responsible for a cancer cluster of very rare cancer called rhabdomyosarcoma. And we were able to close that reactor, thankfully. And since then, the Oyster Creek reactor in Toms River, New Jersey, has been shuttered. Indian Point has been closed, but we're now at risk for these plants to open back up. So the community needs to be aware, needs to, be aware of what's going on, because despite, the rhetoric, and a lot of people will try and say that this is good, clean energy, it's not. And even the Better Business Bureau said that they do not have a right to bill themselves as clean energy. In California, it's really specifically very maddening because this nuclear power plant sits near faults. California is very shaky and faulty, and it's a miracle that nothing has happened yet. And I pray that nothing ever does happen, but the chances of something happen, it can happen. And so for 4% of California's electricity, 4%, when renewable energy is giving you what you need, 51% of California's energy is now created by renewable energy. So I just wanted to be a part of this today so that I could make other parents aware, so that you pay attention to what's going on and that you make sure that you're keeping your family safe.
Thanks so much, Christy. Really important perspective, and thank you for your dedication to protecting children and your long record of work doing so. Now we want to open things up and take some questions from those of you attending today. Please write your questions in the chat. To get things started, I'll kick things off with one of my own, and this I'll direct to Christy. And Christy, I was just about to ask you about the percentage of energy spent consumed by renewables and by nuclear power, but you just discussed that as well. So
Yeah.
let me ask you this: is the push to expand or reopen plants like Diablo Canyon or Indian Point here in New York, which is just 25 miles north of New York City, is that good, sound policy, health-wise and economically?
No, absolutely not. Wind, solar, renewable energy is so much cheaper. It's healthier, it's safer. And, there is something also that I'd like to say in an increasingly violent world. Um, you know, 9/11, the first thing that they thought of doing was to blow up a nuclear power plant. And thank God they didn't. Okay. But in an increasingly violent world, I think people would uh, need to also understand that if an attack were made on a nuclear power plant, there's something called the Price-Anderson Act, and that if since our government has declared a war on terror, that would be considered a terrorist act. You would not be reimbursed for any kind of insurance in the event of an attack on a nuclear power plant. You could lose your home, your livelihood, your health, and you will get nothing from the government who's protected under the Price-Anderson Act.
That's an amazing point. And let me add also, because you so beautifully put it earlier when you were talking about how unsound California is seismically. And I know there's a few people on the call today here from the Samuel Lawrence Foundation, which pay a lot of attention to San Onofre, the Songs nuclear power plant that is now shuttered there. There's 3.6 million pounds of radioactive waste buried on beaches there, beaches that are subject to king tides in an area that is so seismically active, it is nicknamed Earthquake Bay. So, Christy,
Wow.
your point about violence is one thing, but there's a lot of things that could happen by God, acts of God, that could also wreak such havoc with our communities. And there's 9 million people living in a 50-mile radius there, and that would just be a Chernobyl level event. Let's look at some of the questions that people have dropped in the chat so far. Anna Shen, whose notes very interesting so far. I'm in Southern California and 70 miles from San Onofre. I'd like to know if I am at risk. And then, Joe, I'll send that one to you. And then she also asks, how come, this is in response to what Christy said, how come in the public, how come so few in the public understand the risks when, as Christy says, we have labels warning us of everything, such as on our food and things of that nature. So, Joe, that's a question from Anna.
Is the question is 70 miles away a risk? Well, we're all at risk, but obviously the further away from a nuclear plant, the less the risk. Generally, and in fact, what Harvard found, that the greatest risk, almost all the risk, was within 20 miles of a nuclear plant. But that's just from routine releases. If there was a meltdown, such as the ones in Chernobyl and Fukushima, the radioactive debris would spread for hundreds of miles. There would be no way to evacuate safely, and yes, 70 miles away and well beyond that would be at risk for exposure to radioactivity.
Plus, the amount of waste on the site is 2 to 3 times more than what was in Chernobyl, just to give you an idea. So that you know what happened with Chernobyl, and there's more waste located there in California than was in Chernobyl. Also, depending on what kind of evacuation plan, New York City did not even have an evacuation plan for Indian Point. And Indian Point was only 20 miles north in Buchanan, Connecticut, I think it is. So you should insist on having an evacuation plan. I've heard a 30-mile radius should have an evacuation plan. And I know, like Highway 1, you don't want to drive fast on that if you're heading down to try and get out of the way.
And Christy, to your great point about Indian Point, there's currently discussions to reopen that now shuttered nuclear power plant, which is on the Hudson River,
Yeah.
and which is to which they release all kinds of radioactive waste on a regular basis.
Yes.
Currently.
Just recently, they poured a bunch of radioactive waste into our harbor. It's
tritiated water, and that water is toxic. Now, here's a question from Linda Williams. Thank you, Christy. You don't have to be a nuclear expert to know that nuclear power is a harm to our children. So that's more of a comment. Thank you, Linda, for that. Marilyn Ellie writes, is offshore wind considered intermittent? Joe, do you want to field that one?
I'm not an expert in renewable energy, but from what I understand, as time goes on, the renewables such as wind and solar become more and more reliable.
What I can add to that from my knowledge is that, Marilyn, you can also utilize batteries to store the power that is absorbed from solar and from wind to utilize when needed. So even if it is intermittent, you can store it and then utilize it from batteries.
And a lot of people get extra and they sell it back to the grid.
Excellent point.
They're actually making money on their solar panels, and so.
Some states like in Iowa and Kansas are 60% of electricity comes from wind. The country of Denmark, which 30 years ago was almost all coal, is now 60% wind. Yes, there are a number of examples where wind can reliably.
And Hawaii has passed legislation to be, by law, they must be 100% renewable energy by 2045. So there's great rooftop solar penetration in Hawaii. Mary Dixon asks, Utah, or this may be a comment, but let me see. Utah, which was downwind of so much radioactive fallout from atmospheric testing, is not looking at small nuclear reactors at a campus for recycling of nuclear waste and is taking nuclear waste from Canada to store. This is greatly concerning, if not alarming. Can you address the storage and safety of nuclear waste, Joe or Christy?
Well, I'd like to say one thing that I think is terribly unfair is they tend to target communities that don't have the resources to fight the nuclear industry. They will build their power plants or store their waste in areas where it's low-income families just struggling to, put food on the table, and then they hit them with this. And I think it's really something that's incredibly unfair, and that ultimately affects all of us, because the danger is able to happen, they will put the storage tanks there. They will build the thing because there hasn't been the kind of fight necessary to stop it from happening.
The comment I'll add is way back in the 1950s, when nuclear power reactors began, the issue of waste came up, and the government and the utilities agreed, okay, we're going to have a single permanent waste site for all our waste that can be moved from the plants to this site. Well, the 50s is what, 70 years ago now? We still don't have a site. They've tried and tried to pick out plants. There are major safety issues with everyone. The one they really wanted was in Nevada, and it just wasn't going to happen. I think most people agree now that nuclear plants are stuck with this very toxic waste forever.
Senator Harry Reid was instrumental in protecting his constituents there. And what, people need to realize is every step of the way creates additional issues. So if you're moving the waste, any form of transportation then becomes another way to have an accident or a terrorist attack or loss. They've actually lost spent fuel rods before, which is, shocking. But it happens. So the idea of these businesses like nuclear power that are allowed to create the most toxic waste known to man that has a life of forever, is allowed to function just thinking, well, future generations will figure it out. We'll just go ahead and greedily consume all the power right now, and somebody else will figure out what to do with it someday. It's unconscionable.
Fantastic point, Christy. And just to piggyback on what you said, there was a not uncommon major train accident in Ohio in a town called East Palestine where there was a toxic incident. And to imagine this waste being transported around the country to one singular site or to any site is such a great risk to all of us, even beyond the location of the actual plant. Because once it's on the road and in transit, it's as dangerous to other communities as well. Here's a question from
a board member of ours, Bob Alvarez, who recently passed away. He was the senior policy advisor to the Department of Energy. And he told me that we were discussing some of those lost spent fuel rods. And he told me if you were at a stop for the train to go by and there was a nuclear spent fuel rod on the train passing at full speed, you would get a lethal dose of radiation just sitting at that stop as the train passed. So that's the kind of how dangerous this material is that we're talking about.
Wow. That's unconscionable, as you said, and you can only imagine the impacts that has had on our health in the decades that this has been going on. Here's a comment or question from Dr. J, not the basketball player, I assume. Hi, Christy and everyone. I've been an anti-nuclear activist for decades. My mother is a Hiroshima survivor. Wow. I was an advisor to the UN for nuclear affairs and friend of Helen Caldicott. Even after the plants are closed, the decaying nuclear waste is toxic to all and gets into rivers and water aquifers. Here in Oregon, the most radioactive fish on Earth is found from 2 leaking plant wastes. Thank you for that comment.
Wow.
And Christy or Joe, any reactions to that?
I think it's nice to meet you, a fellow fighter for our planet. I thank you.
Joe, anything to add there?
Yeah, we can use nuclear weapons plants as an example of how we're stuck with this forever. In the Cold War, the U.S. was making thousands and thousands of nuclear weapons. and at these various sites around the country. Now we don't make any weapons, but ever since then, ever since really the end of the Cold War, 30 plus years, there has been, I'll put the word cleanup in quotes, cleanup at each of these. And it's going to take a very, very long time. And even the most pro-nuclear people will say that, for example, at the Hanford plant in the state of Washington, the leaks under the ground are moving towards the source of the Columbia River, which goes into the Pacific Ocean, and there's really no way to prevent that. So yes, posing a reactor is one way to reduce risk, but it doesn't end it. This waste will be with us for thousands and thousands of years.
Ella Haydenfeld says, given that Diablo Nuclear currently supplies about 9% of the state's total electricity and 70% of its zero carbon power, although I don't know that it is zero carbon, but Joe, you can address that. What do you recommend California do instead to make up for the loss of energy should Diablo be shut down?
First of all, it's 4% of California's is all that it's producing. And 51% is already being produced by renewables. So, Joe, do you have?
Yeah, I'm not sure where to start on this.
Well, first, is it zero carbon power?
Yeah, that's where I want to start. In the last couple of years, there's been a lot of promotion of expanding nuclear power, and the promotion uses terms like zero emission or emission-free power.
Or clean,
now,
too.
Yeah, and clean. Well, first of all, I know that this is addressed at greenhouse gas emissions. There are three exceptions to this zero emission issue. First of all, nuclear reactors do release some greenhouse gases, such as carbon-14. We see it on the reports to the NRC how much carbon-14 is. Number two, there is nuclear reactors just don't happen by themselves. It takes a lengthy multi-step process to go from getting uranium out of the ground until it is used in nuclear reactors, right? You have to mine it, you have to mill it, enrich it, fabricate it, purify it, transport it, okay? Each one of these steps is a very, very large user of greenhouse gases. And the final thing I'll add is, it's not exactly greenhouse gases, but let's call it heat pollution. Nuclear reactors are all on a body of water, whether it's the Pacific Ocean or rivers or lakes. Every day, a nuclear reactor takes in enormous amounts, many thousands of gallons of water to cool the radioactivity inside it. And every day it releases water back into that source of water. At temperatures generally about 85 to 100 degrees. Now, I don't know of any ocean or lake or river that's 85 or 100 degrees. So that is a warming. And there, of course, aquatic life, fish and others are killed in large numbers by this. So to say emission-free or zero emission is very misleading.
And to address the point about making up for the loss of the 4% of the power of the state,
the growth in renewable energy in California is enormous. Just I don't know, 5 or 10 years ago it was just a few percent, and now, as Christy said, it's 51%, most of which is wind and solar. That was last year. This year it's going to be higher. Next year it's going to be even higher. It can easily be replaced.
And if all the constituents in California would also demand that green energy receives the same kind of subsidies that the nuclear industry gets, then we could see lots of exciting ideas out there from those platforms that float on the water and they have a motion and it creates clean energy and it has absolutely does nothing. And then there's also those scientists that have discovered that they can get particles from black holes in space, and it's enough to power the entire planet without any other source of energy. I mean, if all of these scientists would get subsidies and funding, but unfortunately, the scientific communities are getting axed. So, every day there's more scientists being fired. And I think that's something else that we need to be aware of.
And speaking of those, Christy, Professor Mark Jacobson, I would suggest the reader check out his work. He's a professor at Stanford, and is a great advocate and proponent of renewable energy, and constantly noting how the power grids in California are utilizing more and more every year of renewable energy. On to the next question. Peg Frerking says, can you speak to nuclear waste storage? Even if the Diablo Canyon power plant is shut down, the radioactive waste is still stored locally. I believe we did address some of that, Peg, and I'm happy for Joe to take another delve into that. But we did note that there's 3.6 million pounds of radioactive waste in San Onofre, buried on the beach in a seismic area so active it's called Earthquake Bay. Joe, do you want to talk about Diablo Canyon's waste?
Yeah, I'm not familiar exactly how Diablo Canyon works their waste, but the way it generally works is for the first 5 years after the uranium is spent, is no longer useful in the reactor, it is put in these deep pools of cooled water, these in as part of fuel rods, which are like 10-foot long, pencil width metal rods. Okay, and they stay in there for 5 years while a lot of the radioactivity cools. After 5 years, it is moved into what is called dry cask storage. These are concrete and steel storage units that where rods are placed without any cooling water. The temperature inside these casks are about 400 degrees Fahrenheit. And they are placed, I don't know about Diablo Canyon, but generally they are placed outside of the reactors. All right. Whereas the pools are within, the casks are outside. I know the one in New Jersey, Oyster Creek, they're sitting right off of the highway. Is this a threat? Either for accidental breakdowns or terrorist attacks and all? Yes, it certainly is, because there's a lot of these casks that are out there, again, which were never planned in the 1950s. They thought it was going to be in one area. This was a kind of a plan B they had to work on, which has to work for thousands of years.
Joe, we have a question here for you from Catherine Skopik. Have the 3 recent Harvard studies helped spread the word about the cancer risk of living in proximity to nuclear power plants?
Yes, for a long time. In fact, the reason why our group, RPHP, was formed was because of the lack of studies done by government, done by health departments. Just an assumption that if you release below a permissible level of radioactivity, then that's fine. You can keep your license and the plant is safe. Well, our 2 founders, Dr. Jay Gould and Dr. Ernest Sternglass, said, no, you can't make that leap. You can't make that assumption. You have to do the studies. It's like saying if you smoke a small number of cigarettes, 4 cigarettes a day, then, well, that's That's a low number, so that's safe. No, you have to do the studies first, and sure enough, in the time that since we were formed in the 1980s, there have been more and more studies, not just by us, but other academic researchers, showing that even at the lowest levels, there is risk to humans, especially to the fetus and the infant.
Joe, another question here for this one is from Michelle Lee. Perhaps Joe could talk a bit about cumulative risk. This is something that you were just kind of alluding to. That these long-lived radionuclides persist and build up in the food chain and in the bodies of humans and other biota. Carbon-14 emitted from reactors has a half-life of 57,300 years, according to this commenter, which sounds right to me. This is also why calling nuclear zero carbon is scientifically false.
Yeah, cumulative risk. There is, there are, as I said, over 100 radioactive chemicals or isotopes that are created only in reactors and only in nuclear weapons explosions. Some decay very fast. They have what we call a half-life are days or minutes or even seconds. Others take a long time to decay and stay in our environment for hundreds of years, even thousands, which means that these slow decaying chemicals stay with us. Say you're living near Diablo Canyon, and you're 40 years old. Your entire life you've been exposed to routine releases of radioactivity, and it builds up in the body. And in general, we have found that as time goes on, health-wise, things get worse. That first graph I showed you about the infant mortality. Okay, it was low in San Luis Obispo before the plant opened. It was a little less low in the early years, but in later years, it shot up. It shot up, and now is above. That is generally what we have been finding, and it is certainly what Harvard found.
Here we have a question or comment from Beverly Deschelle. After Three Mile Island's meltdown event in 1979, clusters of cancers emerged. Class action suits consisting of thousands of plaintiffs were dismissed by the court as having not enough evidence to prove the power plant's fault. The plant closed to prevent further litigation. So that's more of a comment. Any reaction, Christy or Joe, from that?
Well, I mean, I just want to say that we did have, and I mentioned it earlier, we did have a cancer cluster at the Wading River, what was it called? The high flux beam reactor at
Brookhaven.
Brookhaven. Thank you. And the kids at Wading River High School, there were a bunch of kids that had rhabdomyosarcoma. And I actually went on Rosie O'Donnell's show and I spoke about it because I was trying to get attention to this cluster in the press, but nobody would touch it because all the networks have, corporate owners that don't want to hear about that kind of thing. So, but Rosie said, come on my show and I'll let you talk about it. And so I did. And as a result, there was a mother, for instance, that had her son. She had moved from that area to Florida and did not realize that her son was part of a cluster from the Brookhaven reactor until she heard it from me on the Rosie O'Donnell show. So it's not easy to get press about these clusters or about, we're doing this online press conference today in hopes of getting more word out because it is imperative that, the communities that surround these plants understand that there are things like this going on. I mean, we went to the Oyster Creek reactor, Alec Baldwin and I. Joe, were you there?
Yes.
Yeah, and there was a cluster there as well, and all the parents were really scared and concerned, and until you highlight it, people don't realize, and then it starts to come together. But the companies themselves, it's very hard. They'll say, well, maybe they smoked, maybe the parents smoked in the house, maybe the cancer's from something else. That's why I always go back to the tooth fairy one, because the strontium 90 doesn't come from anything else. It's a man-made isotope.
I'll just make a quick comment about 3 Mile Island from a research standpoint. A few years after the meltdown, and it was half of the reactor melted down, a group of scientists from Columbia University were asked to do a study, and they published it and found no link between the radioactive releases and local rates of cancer. Soon after that, another group of scientists, this one from the University of North Carolina, took the exact same data and found just the opposite. In fact, there was a link. In fact, in the 5 years after the meltdown, the number of cancers within 10 miles went up like 70% or something like that. And then a fight literally broke out in the journals with each side pointing fingers at each other. Bottom line, we don't really know what the 3 Mile Island effects were.
Linda Williams asks to please announce the need for folks to make comments on new NRC nuclear rules. So I'll just leave that there for people to absorb. To Christy's point, says Lisa Martino Taylor, Millstone 1 nuclear facility in Connecticut, quote unquote, lost 2 fuel rods in 2000. They were never recovered.
That's right. They also had discovered that they had people working there that had lied about their credentials, that were really unqualified to be working there. So there are a lot of issues that pop up at these places.
Let me also ask Dr. J just to remove yourself from the video here, just so we have just the speakers on the panel here, if that's okay. Peg Frerking has another question. I understand that there is research on converting nuclear waste or repurposing it. Can you speak to that to its effectiveness? Does this look like a solution to that problem?
I've never heard of repurposing nuclear waste personally.
I have not either, but Joe, is that something that you have heard about?
Yeah, that's called reprocessing. That was tried as an idea in the United States in the 1970s, and President Jimmy Carter put an end to it. It was very expensive. It wasn't working well, and it was dangerous.
Actually, Bob Alvarez brought us an issue that they were using radioactive metals in everything from baby strollers to zippers on sweatshirts to braces on children's teeth. And we went to the White House under George Bush and were able to get a law that restricted them from using radioactive metals in commercial products like that. But there actually was radioactive metals being used for baby strollers, if you can believe it.
Wow. Let's see. This is from a book from around, this says Ace Hoffman. I'm going to skip this just because it's too hard to read. It has an attachment that is very small. Linda Williams says, let's face it, the government is abandoning geological repositories and demanding states to permanently store on site until they can get reprocessing going to suck out plutonium to make MOX fuel. It isn't clean. It isn't to clean it up. It is to make more fuel. It is extraction, leaving more waste behind. Beverly Deschaux also cites Professor Mark Jacobson from Stanford. He says, we have the means with solar, wind, water, geothermal to transition to renewables now. his book, No Miracles Needed, and the newer book, Still No Miracles Needed, which I have actually right next to me here. I want to recommend that anyone speaking about nukes thoroughly educate themselves about renewables and battery storage, to not just speak to the problem, but the solutions as well.
Yeah.
Susan Hito Shapiro, another member of the RPHP community, says nuclear energy is not zero emission or carbon free. These claims are false greenwashing. Emissions include large amounts of thermal pollution, which continue until all the half-lives are burnt out, emit radioactive greenhouse gases, C14 as radioactive CO2 and methane, and tritium, radioactive steam and water. And nuclear energy production has a large carbon footprint.
That's right.
Ace Hoffman notes Trump just stopped a wind power company from building offshore wind here off the California coast, paid hundreds of millions of dollars to get them to stop. He also stopped several other offshore wind projects. Do either of you, Joe or Christy, want to address, and again, don't want to get too political here, although it's hard not to, but do either of you want to address the hostility that the current administration has toward renewable energy? As Christy mentioned, there are so many subsidies that are given to fossil fuels and to the nuclear industry. And if those subsidies were redirected to renewables, we wouldn't be in the position we are, particularly when you consider that the Strait of Hormuz is a supply chain issue that comes with the territory when you're not producing your own power.
I want to say it's imperative that you get out and vote. Don't let them take your vote away from you. There's every effort. I just heard that the Supreme Court today passed a ridiculous law limiting the right to vote. So make sure you're registered, check it and double check it and triple check it, and vote for our planet. Vote for our environment. Vote for the next generation. Vote for the children, our grandchildren. I wish I had grandchildren, but vote, vote for life on this planet to continue, because we're in a very bad situation right now. The fact that our president is paying, I don't know how many millions of dollars to destroy windmills that were already built and ready to go, ready to, give us the clean energy, is just infuriating and mind-boggling. It's not mind-boggling, because I know they're all owned by the oil companies, and that's what it is. And that's why it's so important for us to vote like there's no tomorrow, because there won't be if we don't vote.
I'm conscious of time, so I think we're going to wrap there. Thanks so much for watching today. Special thanks to our two speakers, Joe Mangano and Christy Brinkley. This is exactly the kind of rigorous, independent science that the public conversation around nuclear power needs, and we're grateful that you brought it here today. To learn more about Joe's report, please visit the RPHP website. It's Radioactive Radiation and Public Health Project, RPHP. It's radiation.org. You'll find the report on the homepage for radiation.org. Look on the RPHP website in the coming days, and you can also find a recording of today's event. And to learn more about what you can do to let your voice be heard on this issue, visit the California nonprofit Mothers for Peace, which is in attendance here today, mothersforpeace.org. So thank you all very much, and thanks for attending.